Welcome to the GeoAI Podcast. This is your host, Ajay Gupta, and I'm really excited to be here for what we're calling episode 4.0. Right. We had technical difficulties, which is actually kind of cool, right? I mean, it's not fun to have technical difficulties. It's not good to have technical challenges that, force your show to not get recorded, but it just sort of, in my view, it's like, okay, we're engaged in the business. That's so things that go in the business are going to happen. So we decided, you know what, rather than scrapping the show or trying to fill it in with some scripting or something, or slicing in the content that was missed and not recorded by some kind of AI, let's do the show again, right? Let's do a show again, and we're calling it 4.0, not take two, not 4B, but 4.0. In honor of one of our favorite generative AIs.
And which
So
generative AI is that, Ajay?
that's ChatGPT 4.0,
There you go.
Model 4.0. And so we're here, we're back. The whole gang's here, Paul, Saiajay, and we're going to talk about GeoAI and the role that artificial intelligence, machine learning algorithms, and processes play in health risk analytics. And let's kick it off. I'm gonna go to you, Paul. Everybody remembers Paul. Paul is our Chief Technology Officer and Chief Geospatial Officer for HSR.health, and he builds a lot of the technology that we use, including the infrastructure and the artificial intelligence algorithms. So, Paul, give us a high-level take of what is GeoAI.
Yeah, sure thing. Thanks, Ajay. Thanks, everyone. So for GeoAI, in my view, you can kind of split it into two uh, compartments or categories, for lack of a better term. With a more traditional take on GeoAI, it is the application of your more traditional machine learning and mathematics based or data analysis based AI processes for geospatial analytics. So, in that realm, it also, again, kind of breaks down into two separate areas where oftentimes techniques such as clustering or image classification is usually done on raster based imagery. So think like satellite imagery or aerial imagery, those sorts of data products that you can do from a geospatial perspective. And some applications of that are land use land cover classifications, as well as more tailored analyses like object detection, like if you want to see where all of the cars are in a building or how cars are moving through an image, and that sort of analyses. On the flip side, with vector related data, um, with that, you have a little bit more of an expansive application in this regard, because that ties more into traditional, actual like data science, like tabular data analyses utilizing AI and ML techniques. So you can do stuff like geospatial logistical regression, or
Mm.
those other sorts of analyses that apply, again, the mathematical models of AI and ML to geospatial analysis. And then on the flip side, with the advent and proliferation of generative AI, I have seen areas in which generative AI for images is used to help or expand and aid the image classification related analyses, but also our take, as you have seen if you looked at some of our previous uh, podcast episodes, is in how generative AI can be utilized to make geospatial analytics more accessible to people who don't necessarily have a geospatial background, by allowing them to ask questions of, in our case, our own analytics and data sets, where they will get a direct response to their question, but also have the map and other visualizations of the data alongside the answer, so that they can start to piece things together. Of, okay, I have this answer, but then here's how the indicator or data that I was interested in is distributed across my area of interest based off of my query. So that's a
Yes.
high level of
Yeah. So, and I like how you ended that, right? So it's essentially putting analytics on a map so you can sort of see where the analytics are making sense, right? And you mentioned a lot of the analytics that go into it. And we're definitely going to get to the generative AI components, right? Because that's sort of a hot topic within AI itself. But let me introduce again, Sajay, and I hope I'm saying your name correctly. But
Yeah. Yeah.
fantastic. Who you've published a couple of papers with us on core math topics, math techniques, data science techniques within health risk analytics, and those have now been published. So I'm hoping the entire audience is reading and seeing your quite good work and detailed explanation of everything. And you did one on regression and one on predictive analytics. One paper on regression, one paper on predictive analytics. I want to just give you an opportunity to introduce yourself and talk about one paper at a time.
Yeah, so just to start off, my name is Saiajay. I'm currently doing a master's of public health at George Washington's School of Public Health. So I had a great opportunity to work with Ajay and Paul on these two projects. So the first project I'll talk about is the recursive regression project. So that was working with the recursive regression that
Say it
Paul.
5 times fast.
Yeah, seriously. That Paul put together a lot of the code behind it, and then looking to see how those regressions for at each state, what the results of those regressions, how it matched up with the literature that the public health literature says on these states on various factors. So how these various social factors and demographic factors affect the outcome of interest, which for me was mental health outcomes.
Yeah, which is a very good one, right? Because every problem in healthcare is a real problem. It's a problem in healthcare means it's impacting people's lives and therefore families and communities. But mental health seems to be particularly pronounced. It affects all of us. Anyone can be subject to it, and we really don't have well-defined treatment plans in place or even available, accessible to provide care for mental health. Right? It's a challenge more so than in other specialties or line items or service lines within healthcare. So I'm really glad you looked at that. Tell us sort of what you did and what some of your findings were.
Yeah, so to start off with, I ran the recursive regression method. There were some multiple technical steps, but the main idea of it was to narrow down. So the data set has all these different predictors for mental health, right? That could be like income level, just proportion of gender, employment status across different zip codes.
Yeah.
And the recursive regression is trying to narrow that down to what are the significant factors.
Right. And so
So
that data set that you're referencing is social determinants of health data. Broadly speaking, social data that we track and maintain on the GeoMD platform. And so your effort was to take that data and identify what is statistically significant with respect to mental health outcomes.
exactly, yeah. And then seeing how does the method of the recursive regression compare to what the literature says should be significant, or how do the trends line up? So specifically, my analysis looked at three factors. I looked at how the regressions for each state looked at income, looked at gender, and looked at employment.
Cool. What did you find?
Yeah, so for income, so to start with what the trend is, the typically established trend for income is as income goes up, mental health outcomes tend to improve.
Right.
So when I was looking at the regressions for the states that included income as a specific predictor, a significant predictor, most of the regressions followed that trend, where as you increased in income level across a zip code within a state, the mental health outcomes tended to improve. There was one outlier though, which was honestly interesting to see.
Tell us about that outlier.
Yeah, so the outlier was the state of Utah. So what it interestingly predicted was as proportion of people within a zip code in the lowest income bracket increase, the mental health outcomes would improve as well, which bucks the trend of saying, okay,
Right.
as your income improves, your mental health improves. So it was very interesting to see
Right.
that.
Yeah, it's very interesting not only because it's happening there, but if it's truly 1 out of 50 states, right? And Utah, any state is large enough that I don't know that you can just discount it as an outlier, right? So essentially what you're finding is that there is belief relative to the literature. The literature is positing a statement that as incomes rise in communities, the instances of mental health go down, right? So yeah, okay. Then that is in the literature, and we see that in analysis of data across 49 states, matching the literature. One state, Utah, which is, there are other things that we could say are unique about Utah, across the union, from the rest of the union. They are different. They find not just a little bit different, but you're actually saying it's the opposite. There, the more there are people on the lower end of the income spectrum, the better the mental health is. That is a finding itself that's worth some investigation. Maybe looking into what Utah is doing. Do they have mental health clinics or resources or services that they are providing in those communities? Or is there truly something about life in Utah that is holistically different from all other 49 states? Certainly something that we'd love to share with our friends from Utah and to get their take on that.
Yeah, so like when I was doing the literature review, so I was like, I had the same question, right? So is this like an artifact of something in the methods, or was this something a little more real? One thing I saw that was interesting and potentially in part could explain that result was I saw that Utah had multiple programs for their unhoused population and seemed to be a bit of an emphasis in the policy on the state level of Utah. So that was one potential theory that I presented in my findings.
Right. And so that's very interesting finding, right? Because you said that it could be an artifact of the process or the data, right? However, again, I come back to that the process was the same for all 50 states. This is the only one that was absolutely reverse of the rest of the trend. So it's probably not the process, and the data comes from the same sources for all 50 states. So probably not data, although it's possible, right? Any, even an authoritative source of data could have an error in it consistent in one part, in this case, Utah relative to the states. But that's unlikely. Then you did find a potential cause, right? That they may be offering more concerted, maybe having more concerted effort on their unhoused population, their homeless population. Homeless are also in the lower end of the socioeconomic or income spectrum. So that may very well account for, or at least contribute to, or at least be indicative of the fact that they are making efforts in that space. So do you remember, just sort of off the top of your head, how was mental health incidence rates in Utah relative to the rest of the country? Were they down as well, or are they just as bad as the rest of America?
So I didn't have a chance to look at that specifically, the actual rates across the state levels. I was mainly looking at the regressions, so looking mainly at like factors that were significant factors within each state.
Yeah, it would be a great follow-on, is to see that, right? To see if this effort, and then there must be some other states that have something similar with respect to the homeless population, right? Or outreach or public service efforts for the homeless population, to see if any of those programs in other states are having an impact. Would be a good follow-on. But I think I'd first start with sort of outreach to Utah to see, okay, are you even aware that this is what the data is showing? But it's a very interesting finding, and it just goes to show, right, that when you do this analysis, interesting things that you may not necessarily think of will come out, right? So this Utah phenomenon, did you see that referenced anywhere in the literature that you looked at?
No, I didn't see any specific mention of any other papers singling out Utah out of the 50 states as like a single state where this bucks the income trend. So it's very interesting. It was made it even more interesting to find that in my analysis.
Yeah,
Yeah.
so I think one thing that is kind of the benefit for the underlying recursive regression method that I implemented, and also by splitting the analysis, not just looking at like a whole national level, but actually having it split out by each of the individual states, is that I tried to take the approach of letting the data sort of speak for itself, right? And I think by taking that philosophy and that approach for this analysis, it is what allows us to find these interesting differing relationships across the different states, and allows us to, again, kind of know that these things exist and are here. Again, with how Utah is probably helping the mental health of their population, especially the lower income populations, with some of the um, initiatives that they're implementing, and then being able to see how the different factors differ across the different states, to see how the differing populations and the differing policies in place and interventions in place are having different effects across the different states. So I think that's one really helpful um, utilization of this methodology.
Yeah, that's great. And this is a pretty interesting finding, where 1 out of 49 is the exact reverse of the rest. Anything else in your work on recursive regression that you thought you found interesting?
Yeah, so I think similarly, in terms of like how I looked at gender versus mental health outcomes, it tends to be that female gender tends to have worse mental health outcomes compared to the male gender. The exception to that, like with income, many of the states followed the literature trend. Iowa was the state for gender that stood out as not following that trend of gender and mental health outcomes. So that was another interesting finding there.
But again, just one state that didn't follow the national trend?
Yeah,
Yeah, that is interesting. So when we say that one state didn't follow national, are the rest of the states pretty much aligned in their trend, their relationship between income and mental health, or gender and mental health outcomes, with some
yeah.
variance? But go
So
ahead.
I would say that some of the states just didn't have, they had other factors represented in their recursive regression. So income, some states, for going back to income, didn't have an income variable in their regression. But out of all the states that had income variables in their regressions, all of those followed the trend except for Utah. And then similarly for gender, not every regression had
Mm-hmm.
a predictor to account for gender. But out of the regressions that had gender-related predictor, Iowa was the exception in the trend.
Okay, so that's adding a little more color in. And so what you're saying is, as you do the regression to reduce the variable set from all of the social determinants of health variables, you may get down to a small, you get down to a small number of key variables, right? And those key variables, and you were looking specifically for income, gender, and one other variable, right?
Yes, employment status. Yeah,
Employment, income, gender, and employment. But those three variables may not necessarily be a key influencing variable in a particular state. Right. All right. So it's not so much 1 out of 49 in these two cases, but it's 1 out of whichever states had that variable as a trend. It makes the outlier a little bit less or smaller of an outlier, but still is significant. Still significant.
for sure. Yeah.
Okay. Good. That's good. So there's the Iowa is, yeah, they must be doing something different from everyone else. If their model, if their mental health outcomes by gender is flipped from the rest of the switch, or from the rest of the nation. Right. Right. Now, your other paper I thought was really interesting, right? Because one of the key points of analytics at all is to be able to predict what's coming in the future, even if it's not a deterministic prediction, but a probabilistic prediction. So, and you did that. You looked for a predictive analytics in health risk analytics. Tell us about what you were trying to do there.
Yeah, so using the same set of data, right, all of these social and demographic factors, these social determinants of health, and the same outcome variable of mental health outcomes as my outcome variable,
Mm-hmm.
I tried implementing a few different types of regressions and models, and then to compare how well each of them predicted mental health outcomes based on those factors. So I started off with the ordinary least squares regression, kind of as like just like the introductory, like the first model to use. And then I moved on to a principal components analysis, combining that with a regression. And then I used something called the lasso regression. And then I ended with a decision tree model.
Yeah, excellent. So principal components now. So let's just talk about them one at a time, just for anyone in the audience who is not entirely familiar with what they are. When I think of principal components, correct me if I'm wrong, right? I think of noise canceling headsets. That's sort of my model, right? There's a lot of noise. But
Mhm.
and we can do this too, right? There may be background noise in a restaurant, and we can still talk to the person in front of us. But that's essentially principal components analysis. It's taking in all the components, whatever the data may be, whatever the components are, identifying one that's principal, and isolating that. I mean, so you can listen to the one audio stream from your headsets versus everything that might be in the room around. Is how do you, what do you think of, how do you describe PCA?
When I think of principal components, I think of like kind of like rotating the data and just kind of like moving it around, moving pieces around to kind of get to these components, right? So that our first few components are the components that have most of the variability, right? So like if you look at a data set, right, some variables might not change the outcome variable as much. Some variables might change it a little more. It's just kind of like mixing it up, mashing them together, and making these kind of like hodgepodge components that you can use fewer components to explain more variability in the data. Yeah.
Nice. Great. And the lasso regression?
Yeah, so the lasso regression is interesting in that it assigns a penalty factor to including more terms, right? So it's saying, okay, if we for a certain alpha value, right? So let's go on either end. If you use a very low alpha value, there's no penalty for including more variables. So you'll just end up with a regression with all the variables you put in. And on the other end, if you have a really, really high alpha, it's going to be a very large penalty for including variables. So you'll end up with what's called the null model, where you just have no inputs.
Right.
So looking at different alpha values, I tried to find the optimal predictive alpha for our data set to then have a regression that excludes some variables to see which set of variables does the best job within the lasso regression.
Right. So it's a
Yeah.
different approach. It's using that's sort of the stick method, right? Versus carrot and stick. That's the stick method. Sort of force the system, the model to be built with the limited number or the smallest number of practical number of variables. And then decision tree. I think everyone's familiar with the concept of a decision tree, if then else type of statements, or you see a lot of decision trees kind of in every walk of life. How do you use a decision tree in data science here?
Yeah, so I think it's pretty much as from my perspective, it's that very like if then statement of like, okay, we can narrow things down. One thing that I appreciate out of like a decision tree or any form of predictive analytics is that it can point in directions for future research. It can kind of unearth these weird quirks in the data that like you may not necessarily have predicted, no pun intended, predicted, but so for example, like in one of the decision trees I made, I saw these different trends that were like, for example, like in areas that were outliers in terms of like the gender ratio of male to female, they had significantly better mental outcomes. And with these predictive analytical models, you can't say that, oh, just because you see that has to be a true trend, but it can be a point to say like, well, maybe there's something there to research into. So that's something I've come to appreciate about decision trees in these models.
Yeah, I'm glad you said that, right? Because I don't think that is what we would anticipate as a common outcome from the use of a decision tree. I mean, right, Paul? I mean, I think the decision tree is something people would think of as, let's walk through this tree and come to the answer, right? But you're saying that go ahead. Go ahead.
Thanks, Jay. So I personally haven't had too much experience with decision trees, and so I do see the reasoning in both the explanations, but another interesting application of decision trees that I worked with another one of our public health analysts on our zoonotic spillover project was utilizing the decision tree to help determine the weights for specific factors in that specific analysis where we were looking at like deforestation versus precipitation versus some other social and ecological factors that were deterministic for the risk of a zoonotic spillover event occurring. So this definitely opens up, I think, people's minds, as you kind of mentioned today, on different ways in which the information from a decision tree can be utilized depending on the use case.
Yeah, man, it's exciting. It's exciting, and I'm glad that the paper has a pictorial of part of the decision tree that you used. The whole one was just too large to print. but that's excellent. Any interesting findings in that research there?
So I guess in terms of like predictive power, they were all pretty comparable in terms of like the mean squared error. Scaling back to what the original like variable was in terms of like percent of mental health, poor mental health within a zip code, the predictive models were able to predict it on average within like 5% of that. So which was pretty impressive in my opinion, but
So within, yeah, it sounds very impressive. So let's understand exactly what that is, right? You are you saying that with these models for prediction, that any public health, anyone who runs these models could predict to within 5% the uh, who or how many, not who, but how many within a zip code are likely to have mental health challenges?
yes, but I will qualify that. So the way, and this is something I think is a future direction of this predictive analytical work, is that when I implemented these models, I used all of the variables, all the social determinants of health available. I put them all into the model. But in practice, right, I don't think it's going to take a lot of effort to collect all of that information. So in theory, right, if we use these models and we had all this perfect amount of information with all of these factors to plug into the model, we could potentially get to a estimate within about 5% on average. But I think in practice it'd be tough to get all that information.
Well, we already have the data for the country, right? As you noted. So
Mhm.
the the data you used is the data we have. So we have the data. So now my first thought was we know the population changes, right? Every day people get older, new people are born, and some pass on and move. We move, right? There's a lot of movement throughout the country. So that suggests that if an organization was planning for the next 5, 10, or 15 years, they could model what the population will be in the future, leverage these data then to estimate what the future, based on some, the model for the population change, and estimate what the mental health need at that time would be.
Potentially, yeah.
Is
And I
that
think with that, I would say is in my perspective, I would say if we start modeling for changes, that includes its own sense of error, and that might
yes?
affect the
Yes.
the error bar on the prediction to expand past
Absolutely. So the error in the
5%.
synthetic population of the future, right? Essentially creating a digital twin of the population so you can age the population. Whatever the error there is, has to be added to the roughly 5% error in predictive power that you found here. But that's very powerful, right? Okay, let's talk about what the 5% is. Does that mean that of the population of the zip code, the percentage who may have a mental health challenge or incidence or need, that could be 5% up or down, meaning if 20% have an issue, we might have seen 15% or 25% by the prediction algorithm?
Yeah, I would say that's how I would interpret it.
Right. So it gives us a 10% range on the zip code basis of who may need this particular type of health service, mental health service. I think that's, close enough for planning purposes. It's close enough, if you will, for preventive measures, especially health education preventive measures. That is a very powerful finding. I mean, it supports the entire notion that prediction of future health needs and uh, requirements are plausible.
Yeah, one
Yeah.
caveat I'd like to bring in before we move too far along uh, from this current talking point is that we brought up the topic of we in the US we have the data, right? We have all these census variables that are pretty encompassing. I think for our analysis we include at least 100 different variables. However, from my own experience, unfortunately, in most other countries around the world, you don't have that same sort of access to
Mhm.
the same number of variables as
Right.
well as the granularity of variables as well. So I think one thing that is interesting is with the kind of predictive power that we can see here with these sorts of analyses, hopefully this can lead to other countries improving their data collection efforts and the sort of variables that they retrieve from their censuses and other equivalents that they do, so that they can take advantage of these sorts of analyses to help in the initiatives that they are working on within their own countries as well.
Yeah, that's great. That's great. So, and this definitely does suggest the power that data science techniques can have for health risk analytics, right? Whether you call it AI, GeoAI, or whatever, you do need an underlying data. But I suppose if we put all of this together, right, the principal components analysis and regression measures with prediction, you don't need all 100 necessarily, right? You need those variables that are going to be influential in the outcome. Now, we may not know that at the beginning, but now that we have this sort of model and this capacity to model, there may be those that we could learn, right? So to other nations, essentially, as you're saying, that we have hundreds of data points in the country down to the census tract level, and then we have more and different kinds of data too. It's not that other countries have to replicate all of that necessarily. They could replicate a strategic subset of that and then take advantage of greater predictive power for health outcomes and healthcare research and care delivery mechanisms.
That
Go
is
ahead.
true. But the caveat there again is
They don't know which
applying.
ones. Yes.
Well, not no, they it's on. You can't necessarily just take ones that are statistically significant for the U.S. and transplant those to like Europe, because the actual factors might be completely
Might be
different.
totally. Absolutely. We see that here, as Sajay has said, right? That not the same factors that influence or are correlated to mental health outcomes aren't even the same across all 50 states. So they're certainly not necessarily going to be the same across the world. It's just a starting point, right? Because if you tell someone to collect 100 data points, that's a big challenge relative to collecting 3 or 5 data points, right? But you're right. There is the reality is that if you do want the true predictive power, you kind of need to start with 100 data points for all across your country, then use these mechanisms to regress down to the critical set, and then proceed with the analysis.
Yep, that's very true. And one thing I did want to bring up as it relates to, there is kind of a shared philosophy when it comes to the recursive regression approach, as well as with the principal components approach, of strategically narrowing down the significant factors of interest. And so the challenge that I've seen, or I've thought of in the past, is with principal components, because of kind of the melding of the different variables together, it can be difficult to tease out the how much of get back to your original variables, because when you do a regression based off the principal components, you're doing the regression on the components and not really on the underlying initial factors that you kind of started with before you created your components. So I think there are ways, and I'll let Saiajay expand on this, but I think there are ways to kind of tease out like what proportion of the original variables each component is created in, but it can be still difficult to really tease out, okay, if you reduce the number of people at the lowest income bracket by X percent, then you expect to see a X percent decrease in negative mental health outcomes. Like, it's a lot harder to do that sort of an analysis. Whereas with the recursive regression analysis, it takes the same similar sort of approach of trying to let the data speak for itself and determine what the significant factors are, but you're able to retain that. If you reduce this factor by this much, then you get this change in the outcome variable, which I think is useful, especially for like decision makers, as an example.
Yeah.
Saiajay, would you like to expand upon that for the PCA stuff?
Yeah, I mean, just to echo everything that Paul said. Yeah, so part of my analysis in the predictive paper was looking at, right, so you did a few regressions with just like the first three principal components, the first six principal components, the first nine
Mhm.
principal components. So there's a way to get like, okay, what percent in each component, what percent of each original variable is contributing to that component, right? And then saying across these first X components, what variables are contributing the most. But it's very hard, and I don't know how I would do it, or if it's possible to go back, like Paul said, and say, okay, based on these principal components, how is this original variable contributing to the outcome of mental health from a principal components regression?
Yeah, maybe that'll be a subject of a future paper, because that concept of assigning the contributing components, or no, that's the wrong word because we're talking about PCA, but assigning the level of contribution to each variable to the outcome in question is very powerful in helping those who want to address that health outcome, health systems, communities, uh, know how much energy to put into addressing each of those, causative variables. That's a potentially a next step. But I wanted to ask you, Saiajay, where do you think this research? We talked about it a little bit sort of all throughout the episode, but where do you think is the next step in this research overall?
Yeah, so I think especially just going with the predictive paper is like I said previously, I threw the kitchen sink of variables at the models, and I would just be interested in seeing like what happens if we artificially select different subsets, and that those subsets could be informed by the recursive regression, seeing right how we're talking about how in different states we have different um,
Right.
variables contributing. What happens if we limit our predictors to those subsets or different subsets of variables, and then also thinking in terms of how we cluster for regressions, right? So for the recursive regression, it was clustering by states and saying like, okay, let's use all the zip codes from one state to produce this state's regression, right? What happens if we either zoom in to like county level and
Mm-hmm.
looking at regressions at different county levels, or zooming out to just like more broad regions, like thinking just like based on where I'm at, like instead of doing a regression in Massachusetts, you do a regression in New England. Thinking of
Yeah.
that region,
Regional areas. Yeah.
or like the South or the Southwest and so on. So those are a
Yeah.
couple of directions I could think of going.
Yeah. And that would help to showcase the differences by region throughout the country. So one thing that I want to ask is that this sounds, and it's technical work, right? So to do this work needs a little bit of technical skill and aptitude. But generative AI suggests we can get a lot of answers to a lot of questions by just asking a question, typing it in, or speaking it into a natural language prompt, or what have you, Paul. So, you referenced Gen AI at the beginning of the episode. Do you see a generative AI front end to these powerful data analytic capacities coming anytime soon?
Yeah, most definitely. It's actually kind of something that we're working on, and so I would s- I
We
would
lost
again
such a.
kind of split it into two areas where on especially from a end user perspective, right? If you have hospital administrators or county departments of health, those sorts of end users for this sort of an analysis, you want to try to make the availability of these powerful analytics easy for them to engage with and easy for them to kind of understand, just look at what the output is and then be able to start making decisions on like policies or interventions or whatever they want to do to help to try to tackle the issues to improve the health of their populations that they serve or are within their catchment area. Um, so that's kind of from a public health side or an end user side, and I think we're already working on that area. But to support that sort of ease of use from an end user's perspective, I have kind of it more work kind of falls to the actual data scientists like myself or at any other analytical company, because whilst the capabilities of generative AI to, say, perform some of these analytics is probably coming on the horizon because you just continue to see more and more advances in generative AI. The perspective that I've been having on the utilization of generative AI is to take advantage of its language comprehension capabilities and its corpus of knowledge to integrate LLMs into a broader, in my case, Python orchestration framework that allows for the offloading of, say, the data manipulation and the execution of these data pipelines or more mathematical AI functions to tools that are better suited for those jobs, mainly for the reason
Right.
of to limit the impacts of bias and hallucination that you could potentially get from solely relying on the LLM to make sure that the resulting output and resulting data and information that the end user gets is still kind of directly tied to the actual data, right? And so that's been
Yep.
a guiding
Yep.
philosophy that we talked about a little bit in
Yeah.
the previous
In
episode
previous
on this show.
episodes, yeah. Yeah, so yeah, it shouldn't be a surprise to anyone that LLMs aren't necessarily best suited for doing math, but they can have a role in helping to kick off the right math algorithms to solve the problems. Well, this has been a great episode. I'm delighted that we were able to retake it and get it up and get it live. Saiajay, thank you for working with us on these projects and joining us for this podcast. And we certainly look forward to seeing what you're going to do next. In you mentioned you're at the Millikan Institute of School of Public Health at George Washington University. What's next for you there?
Yeah, so first of all, thank you for having me and thank you for letting me work with y'all. It's been fun. As for what's next, currently just trying to wrap up this my degree. I'm hoping to graduate from the Institute of Public Health in this by the end of the spring. So hopefully all
Cool.
goes well there.
Fantastic. Yeah, graduation's coming up. That's excellent. Congratulations in advance. And we look forward to seeing what you do in the rest of your career. Thank you, everybody, for joining us. We will be back with more episodes of the GeoAI podcast. Check your listings.